Okay, my name's Colt. I'm going to do a quick assessment here. The first thing I would do when I walk in the room is I want to make sure I wash my hands and glove up. Then I'm going to ID my patient. I would physically ask the patient their name, and then I would come and I would check their wristband, make sure it matches the patient. On the way to the room, I would observe my patient. I would check for gait, make sure that their gait was balanced and smooth. They have no abnormalities. I would check their physical hygiene. You know, you look, he's good, clean, he's a clean-cut guy. He's got no dirt or anything that you can physically see. And then what you would do is you would you would want to check their behavior, you know, just to make sure that they're okay. I mean, he looks relaxed and calm. He doesn't have any kind of anxiety or anything going on there. Then we would go into doing the assessment ourselves. We'd start with the head, just kind of come around. Do you feel anything tender up here? Okay, there's no tenderness on the scalp. We would observe for like rashes or lesions. The hair appears to be normal, and then what we'd go down is we'd go ahead and observe the face. We're looking to make sure that the nose is midline, that both eyes are at the same level, both ears appear to be at the same level. We could go ahead and check the ears and make sure that there's nothing, no kind of serum or anything that might be coming out, any kind of fluids. Is your ears tender at all anywhere in here? Okay, there's no tenderness in the ears. We're also observing for rashes and scars and lesions. Then we go on to the eyes, and you can go ahead and look straight ahead for me. And here we're just checking to make sure that they have good accommodation. Go ahead and look at my finger and look at the wall. Look at my finger. Okay, and it's got a good perla. We're going to go ahead and have you just relax, look up. Okay, the conjunctiva is pink. The sclera appears to be white. So that appears to be normal. So then we can go ahead and look in the nose. Just go ahead and kind of tilt your head back a little bit for me. And I don't see anything that might be blocking the nose. Can you breathe through your nose? Okay, he's got good breathing through his nose. Let's check the TMJ. Go ahead and open up your mouth for me real quick, and then close. And then do it one more time, and then close. What we're looking here is we're looking to see if the mouth opens smoothly, and then which it does on him, and he has no clicking or crepitus or any kind of popping. If there was, you could auscultate just to get a further assessment of what's going on. So then what we would do is we'd go ahead and move down to the mouth. Let me go ahead and have you open your mouth, and we can look inside, check his teeth, check the mucosa, make sure everything is pink. Go ahead and say ah. Okay, and the tonsils appear normal, which is a +1 with no exudates or no kind of swelling or anything going on there. Can you go ahead and clench your teeth down for me? Okay, and the teeth line up midline, so that's good. They line up exactly where they need to be. Go ahead and relax. Check some lymph nodes. And we're just going to kind of palpate down just to make sure that there's no lymph nodes. Lymph nodes you typically can't feel, but you have to make sure that they're not swelling or anything. We want to check his sinuses while we're here, so we're just going to kind of push. Do you have any kind of tenderness or anything in here? Okay, that would kind of be typical with any kind of long-term chronic sinus illnesses or anything of that nature. Go ahead and stick your tongue out for me one more time. Okay, we're just making sure that the tongue comes out midline, that it doesn't have any kind of ulcers or anything on it that might be of a problem. While we're here, we're going to go ahead and observe the neck. We're looking just to make sure that everything lines up symmetrical. Is there anything tender to the palpation here? Okay, the skin is warm. It doesn't have any kind of change in color, so that's good. We're going to check his carotid. This carotid is strong and symmetrical. It's a +2, so that's normal. Then what we're going to do is we're going to go ahead and go onto his back and check a few things on his back. First, I'm going to have him just kind of bend forward a little bit, and I'm just trying to observe to see if the spinal column is in midline, which it is. It's an Adams test, so there's no scoliosis noted. Go ahead and sit up for me. Do you have any kind of tenderness or anything back here? Okay, no tenderness. So I'm going to have, what I want you to do is when I put my hands on you, I want you just to say 99, okay?
99. 99. 99.
Okay, we'll go ahead and do it in the front too, since
99. 99. 99.
Okay, and that's tactile perimeter, and that appears to be normal, so there's nothing that we noticed there. So then what we're going to go ahead and do is we're going to listen to the lungs. Okay, I just want you to take a deep breath, okay, whenever I put it on you. Okay. Okay, and that's the top lobes of the lung, and they appear clear and bronchial. Go ahead and do it again. Okay, the middle lobes are also clear, and they're called bronchovesicular. And the lower lobes are also clear, and they are vesicular sounds that are heard. Okay, and then what we would go ahead and do is we can come around to the front, and we can I also need to check lung expansion here. So what I'm going to have you do, and I just want you to take a deep breath for me, all the way out. Good. So lung expansions appear to be normal. We're also going to check the AP diameter versus the thoracic diameter, and just to make sure that there is that everything is normal. So, and it appears to be normal here. So that's good. Then what we're going to do is we're going to come around. We're going to go ahead and listen in the front to the lungs. First, we can just kind of observe the chest just to make sure that there's no kind of abnormalities or anything going on. So, go ahead and take a deep breath for me. Out. One more time. And out. Okay, and they're clear and bronchial too. Okay, and that's clear there. Okay, and that's also going to be clear. Now in the middle you're listening for a bronchovesicular, and in the lower you're still listening for a vesicular sound. Okay, we're going to go ahead and have our patient lay back for us. Oh, you know what? Go ahead and sit up for just a second. I'm sorry, I need to check your upper extremities before we have you lay back. Okay, what we're going to do is we're just going to first make sure our patient has a good range of motion. Do you have any pain or anything in here? We're going to observe the patient in the arms and everything. We're going to make sure, you know, the hair appears even, hair distribution, the skin appears even. There seems to be no kind of rashes or lesions or anything. Go ahead and put your arm up here, and don't let me pull down. Okay, and don't let me push you back. Okay, and he's strong, so that's a +5. And then what we're going to do is we're going to check capillary refill. Just go ahead and relax. And okay, that's normal. You're looking for it to be anywhere from 2 to 10 seconds just to make sure that it comes back. But his came back very quickly, so that's normal. So now we're going to go ahead and have you go face up for us. Okay, so then what we're going to do is go ahead and look over that way for me. We're just looking for a JVD. Make sure that there's no kind of pulsations or anything. Okay, go ahead and relax. And then what we're going to do is we're going to come in here and palpate for the heart. We're going to palpate at a couple different sites here that we're fixing to listen to. Then we're going to come in. We're going to go ahead and auscultate. Okay, that's the aortic on the right-hand side here at the second intercostal space. On the left-hand side of the second intercostal space is the pulmonic. Down at the fifth intercostal on the left-hand side by the sternum is going to be the tricuspid. And then mid-clavicular line, fifth intercostal, is going to be the mitral. Okay, those are all normal. And then what we're going to do is we're going to palpate also at that point for the apical pulse. Okay, and that appears to be normal. So then we're going to go ahead and go down to the abdomen. The first thing we're going to do is we're just going to visualize, we're going to look at the abdomen, make sure that we don't see any kind of pulsations or anything that might be abnormal. He's got good skin color, expect it to be a little bit lighter. He's got hair distribution, which is normal for men. So then we're going to go ahead and auscultate first. We're going to auscultate the 4 areas. The upper and the lower quadrants on both sides. Okay, and we're listening for any kind of abnormal sounds, bowel sounds, gas sounds. After we get done with that, we're going to go ahead and palpate. I'm just going to do a light palpation. Any tenderness with that? Okay, going to do a little bit deeper on the second round. Okay, and there was no tenderness with any of that, right? Okay, what you could also do here is auscultate for bruise. So what we do is we flip our stethoscope around to the bale. Okay, no bruise.